and I think they're okay. If anybody has anything else to say, or if not, could someone make a motion to approve those minutes?
This is Bob. I'll make a motion that we approve the minutes.
Second?
Okay, yes, I second.
Okay, it might be easier to just say anybody against the approval of the minutes from last time. Okay, so let's pass that. So that's done. Is Mr. Sheeler here? Are you here, Fred?
He is. He's unmuted.
Yes, I had to unmute myself. I'm
Okay.
here.
As long as you're here, let's run through a quick, you have anything to report as far as property management issues?
Well, as you know, with the emergency, the health inspectors are pretty much shut down. They had done a good, thorough review of all the area food establishments to make sure they were abiding by the governor's orders, and they found really good cooperation. They really didn't find anybody who was trying to stay open as far as.
I was curious, were there any different dictates from, you know, this agencies above in regards to handling cleaning now that you know, the virus is around?
No, there was nothing different than their standard.
Okay. All right, very good. Before we get into the report from the fire marshal, let me just go over some things. There was an email floating around this morning and a lot of talk in the last week about why are we in Berks County kind of at a loss for detail. If you look at Montgomery County and you know, Delaware County, they get all this great information. They show you exactly where in the county people have it, you know, their age, et cetera, et cetera. And the question is, why don't we get that here? Last week we had discussions about that, and people were under the impression that the reason was because we did not have either a county health department and that they would only give it out to county and local health departments. So since I don't know if we're considered a health department, but we have a board of health. So I called last week and said, look, you know, I'm chairing the board of health and it would be helpful for us to know what's going on in the city of Reading. You know, why can't we get information? They said they would get back to me. In fact, they said they'd get back to me that day. Never heard. Called again this morning, finally got through to somebody. And the lady seemed a little perplexed because she said, well, yeah, a lot of counties, most counties don't have health departments, but the Pennsylvania Department of Health has an office in every county, and they kind of do what the county would do. The counties historically were given the option of either having their own health department, private, and the state gave a little bit of funding towards that, or you didn't, and you just had a state office in your county, and that's what the majority of them have. So I said, well, you know, we have a health department. I mean, couldn't we get, or we have a board of health, couldn't we get that information? And she didn't really know. So she said she was going to get back to me within 15 minutes. Well, an hour later, a very nice woman calls me a nurse. And this nurse that I speak to happens to be the nurse who covers Jefferson County, who, just like Berks County, does not have a health agency. So the state has an office there, and she's the person for Jefferson County. So, of course, I said, well, why am I speaking to you? I wanted to speak to the person from Berks County. She said, the phones are so screwed up, we just take calls when we can grab them. But we had a discussion. She said, no, she can't give her information to anybody, even if there were a board of health in a city in Jefferson County, even though that's her, she said, I can't give my information to anybody. And I actually seem to understand more about why that was than she, because if any of you read the article that was circulated this morning by Michelle, I don't know where she found it, good job, but it was a story about why Pennsylvania has this peculiar situation where we can't get the information out. And if you read that article, it has to do with some old rules that dated back to the time when the Pennsylvania Department of Health was mostly worried about venereal diseases, and it was privacy issues, and there's some court case and yada, yada, yada. And clearly we are not the only ones in Berks County who are mad as heck that we can't get better information. So I pushed the issue, and she said she would push it up the totem pole and get back to me. So I will continue to make an appeal for, you know, if we have a board of health and we have doctors, including an excellent infectious disease doctor, you know, it'd be useful to have that information. So I don't know whether that will go anywhere, but we're not alone in having a paucity of that information. Lots of people out there are irritated for the same reason. So maybe I'll have some more to add, but I think that's the whole story on that at the moment. I did see, for people who want to know a little bit more about what's going on in the area, I read somewhere that both St. Joe's and Reading have a website that will depict how many people are in their hospital. And I found St. Joe's, and they show you how many people are in hospital with it. But just to know kind of what's there. I could not find anything on the Reading site, but I was told that there is such a site. So that's about all I have to update on why we're not getting any more information here. It looks like we are at an impasse at the moment. It sounds like a lot of political leaders are getting heat because people are talking back to them about this very issue. Any comments or questions before we leave that topic?
If I can just weigh in, Dr. Dethoff. I mean,
Yes.
I sent that email out, and you looked at the graphics that Chester County bring to bear. Here's Kathy.
Hi, finally,
Yeah.
my tech person came.
So, I mean, I read that article, and it goes back to the peculiar law, like you said, from 1955. I think that it, you know, and I mentioned in my email, it does kind of handicap us a little bit, especially for planning, understanding what is going on around us, as far as other municipalities, because what goes on around us eventually, once it's around us, we're you know, it's going to be a problem for us too. So it's interesting, and you know, based on the lack of having the Department of Health locally here, going through the state, like you said, I don't know if Fred Latcha can weigh in, if there's anything that can be done from the law department side.
We can make a request. I do think that there is a difference between a health department and a board of health that could be difficult to get that. But certainly, I haven't looked into the state law. From reading, I didn't have a long opportunity to review that article, but it seems like it's a law that's been on the books for 100 years. So I can take a look at that, see if there's anything we can do to adjust things. I doubt it would be in time to get anything in the near future, but who knows how long we're going to be needing that type of information, and it would be helpful to have it for the next event.
Yeah, I would say, even to piggyback on everyone else's frustration, I mean, there seems to be a long history of court challenges that the state has managed to continue to hold this position. But I still think it's worthwhile, even those, whatever happens moving forward, it is a valuable tool to have that kind of information.
Yeah, I would be happy to get just the numbers of what's in the city of Reading. I've expressed, as we all have, the concern about the conduit between Reading and New York. The other thing is when you look at, people who are more at risk to get this in the first place, or the mortality figures once you get it, it's all about comorbidities. And if you look at what the comorbidities are, they're obesity, diabetes, hypertension, and lipid problems. It's the city of Reading, because we are not a healthy city, and it could really wreak havoc if it comes into our city in great numbers. Do you have anything to add to that, Dr. A? Or was my
my worry is that the fact that we have so many people who work in factories, and the population that is diabetic older than 50, they're working in factories that they're all standing beside each other, and I'm not sure how much they are protected, and how much, all these factories, many of them produce food. So they are essential jobs. The people are still going. They're going to the mushroom factory. They're going to the chicken processing factories. And I've had, I know that, I cannot say, but I've had cases where I ask the people, where do you work? And I'm told where they work. And I'm like, where do I go now? Like, somebody should be capable of saying, or there should be some kind of supervising entity we can go to as physicians, rather than just telling the patient and trying to explain to the patient what they should do to stop the spreading, and give the patient 14 days off work, because most of the cases that I am getting in the outpatient, they're not in the hospital. People are staying home. There's no way, they don't be in the hospital, but they can be spreading it to their grandma. They can be spreading it to their neighbor who has medical problems. So, I think that is the one thing that is a scary point. That's why I'm like, I think that what happened is that the health department is, in a way, we know it's happening and they're not really doing a lot to not only to let us know what it is, but what are we doing to stop the spreading? How are we helping people so they don't keep on spreading it?
Dr. A, in the early days, it's the early days of this infection, especially when they had that first case in Montgomery County, of course, there were, people from the CDC there, and they were tracing down contacts, and, they were trying to get it out before it got out. But, isn't the cat out of the bag? I mean, is there still usefulness if manpower exists?
No.
We don't, to try to trace
no,
down?
there is. I don't think at this point there's anything to be done to actually, do tracing. But I think something should be done when it comes to the reporting part. When somebody is in a situation that that, by the time the patient calls me that they have been having fever for 2 days, and I check them and it needs 7 days to come back, because that's the time we have to wait for the test to come back. By that time, a lot of stuff had happened. So
Sure.
if we had somewhere to call, like I'm going to give an example. A woman calls me. She's like, I've been home for 2 weeks. I'm having fever and a cough, but my husband has been going to work, and he's been having fever and a cough, and then I started. So she was my patient. I could test her. She is positive, but how I am going to be capable of, making sure that people know that this person, the husband, should not be going to work.
Yeah. Well, there's
tell the patient, but how much they are going to do it.
Yeah.
You know what I mean? And
Well,
I cannot
big
call
problem.
his employer to tell him.
I think a lot of people don't have the ability to easily self-quarantine. If you've got 6 people living in a small apartment and somebody comes down with it. Yeah. Now, I know some cities are trying to figure out places to, permit people to go and self-quarantine, but that's a big undertaking and requires a ton of money and staff. So I don't know if that could happen around here, but I don't think it's our fledgling Board of Health that can get that together.
No, that needs a higher, that should have been done long ago. Yeah.
All right. Shall we hear, Jeremy, were you going to give the first responders report, or was that going to be Mr. Stout?
Yeah, I could speak from the emergency management perspective.
Yeah, because everybody here their biggest first concern is what's happening to we're not concerned about what's in the hospital. That's not our business, but we're concerned for you guys. So tell us what it's like out there.
So we have been planning extensively, probably over the past 2.5 weeks that we've ramped up our planning. We have started retaining resources, both the fire, police, and obviously we run the ambulance service. So there's continuity plans in place depending on the amount of staff that could potentially have to be quarantined, or if we sustain a significant amount of members that can't work. So that planning has been done individually between the fire and EMS and then the police department as well. We as emergency management function as the funnel for information, and then we disseminate based on needs, requests. We disseminate those supplies. So we've attained a significant stockpile of some basic necessities. We have planned in concert with the police department to make sure that our members and their officers have the appropriate amount of personal protective equipment. We're constantly monitoring our day-to-day calls for service and continually reassessing our burn rate because we are concerned with the interruptions in the supply chain for our ability and that affect our ability to attain personal protective equipment. On top of that, we've provided a significant amount of education to other departments to get some kind of debunking some of the myths about COVID-19 out there. But again, we function as a resource for everyone in the city. So there's a lot of moving parts. I have Chief Bauer, who's on the call as well. He is a deputy emergency management coordinator, so a lot of us wear two hats. And a lieutenant in my office is an emergency management coordinator as well. So I do have a lot of help, which is great. I think this is going well. I would say that we are currently part of Berks County's EMS or COVID-19 task force. So basically what that means is all the EMS agencies in the county meet on a daily basis at 10 a.m. each morning. And we have pooled our resources to basically make sure that no one is completely without everything. I can say that we are, I would say, far ahead of many other services when we look at what our numbers are as far as quantities for personal protective equipment, far ahead of anyone else, which is good.
Well, that is good to hear.
So at this point, we still continue to make arrangements to increase that because again, we are concerned about the surge as it's been referred to.
What is your supply chain for getting PPEs? Does this all come down through the state to the county to you? Because somebody's controlling all of that.
So at this point in time, we engaged the administration early on, and we basically said, look, our current budgeted allotment cannot sustain us or adequately prepare us for this event. The administration has been fantastic in supporting us as far as providing the financial aspect of attaining all the personal protective equipment that we have. So we function as that arm. I obviously oversee a lot of that for the potential if there is reimbursement under this declaration that has been offered not only here but statewide and federally. So we have procured a lot of that on our own. The county, for instance, placed a $3.7 million order the other day for personal protective equipment. So the issue with that is obviously the supply chain interruptions. And also, my understanding is some of that money or some of those supplies when they do come in are going to be going to the hospitals as well. So it's not like we can really count on that. The process for us is if we have an unmet need, if we can't fill that locally, then we notify Berks County's emergency management and we say, look, we need 100 gowns. And then if they can't meet that need, then they elevate it, goes to PEMA, and then it can be elevated obviously to FEMA. So that's typically the latter process for unmet needs.
Right. Okay. I know when
are the EMS crew wearing masks at every call, or the calls are being screened to decide what they need to wear?
So yes, absolutely. That's a great question. So we have transitioned now as in concert with the police department. We are requiring all of our members to wear at a minimum an N95 as well as glasses in any contact with the public. So obviously our paramedics wear a little bit more depending on what based. But that is the absolute minimum. We are wearing the eye protection and the N95s for every interface with the public.
And I don't know if you went this route, but I heard from some friends of mine in other cities where they were capable of getting some supplies from dentist offices that they had masks because dentists are not open. I don't know if that's the source that you were capable of using.
Sure, we've received some smaller donations. We just got about 200 N95s the other day that showed up at one of our firehouses. So that's been helpful. Yeah, absolutely.
Okay.
I know when we had exchanged emails about a week or two ago, you sounded like things were getting desperate because I know you were looking for possibly for autoclaves. So
Yes.
that started a search by me and Dr. A on the question of, well, what does anybody have to say about, officially? And there was a good article. I didn't circulate this to everybody. It was called 5 Ways to Cope When Masks Run Low.
Mhm.
It was not, this was supposedly all information coming down through the CDC. It wasn't very helpful. What they said is, first of all, you extend the wear, meaning you wear them longer than you should, or you reuse them. Some people put them in a paper bag, let them rotate. Hopefully, if they sit a few days, they'll the virus won't be there. Then they go on to talk about ways for decontamination. But they said this is only if it gets to be the wild, wild west.
Sure.
But then they went on to say they didn't give very much useful information. They said people are trying ultraviolet light. They don't know if that works. They're trying vaporous hydrogen peroxide. They're trying various forms of heat. But they did point out specifically that you shouldn't be putting them in it says, I'll read this specifically. The CDC guidance also noted that decontamination with an autoclave, 70% alcohol, microwave radiation, or soap and water resulted in significant filter degradation.
Absolutely.
They also don't want you to bake them at home. They don't want you to put in a tanning bed. They give you all these things they don't want you to do. And at the end, the best they could say is, if you got nothing, a homemade substitute, meaning the masks that we're all out making now, you could use those. So they did not mention that cockamamie idea that I had, but I don't think we should employ that unless we get to the Wild West.
Sure. Well, we have some other options at our disposal. For N95s, obviously, we have some regular full mask cartridge respirators. If things get really bad, we can move to that. Those are in short supply. We had placed an order, but the federal government actually took most of our order, and they basically told the manufacturer that had set some aside, we're going to take all those filters. So that got backed up. And we do have some older PAPRs. We have some filter issues, the post 9/11 PAPRs. So it's just, it's an issue where our guys are pretty good. So what we've done with our N95s is we are replacing them right now. Just for the city of Reading, we have probably about 1,040 in our backstock right now, which is a good number as it sits right now. We are expecting another order to come in. They're the 12th or 13th of next week of the KN95s, which we were able to get 3,000. So obviously, they're close, but they are better than the alternative of wearing something less protective. So if our guys treat someone that they believe is COVID positive, we are changing out and we are completely discarding that N95 as well as all the other PPE, and we will issue them a new one. So
Dr. A, as the infectious disease expert on the panel, what do you have to add about extended use, reuse, decontamination? I know in the hospital and medical fields, people are trying to figure this out as well. Do you have anything to add?
I think it just depends on how much you are being exposed. So, for example, in the hospital, I don't think that they're putting any kind of limits on that. But for example, for us in the clinic, because we're not seeing a lot of patients face to face, it's all happening through telemedicine. We are being given one mask a week. And I'm talking about regular masks, not N95 masks, the surgical masks to use as we, so we're giving that with a paper bag to use it throughout the week. So I think it just depends on the situation and the exposure. And I think at this point, we just have to trust the people who are actually doing the job and seeing these patients to know when they think that the exposure was significant, that they need to discard it, and when they think it is not, that they need to keep it, because any kind of person that is in the front line in this situation knows and understands how much it is important to keep the masks as much as possible, but at the same time they need to feel safe to protect themselves. So I think the decision when to throw away the mask or not depends on actually the person who is doing the job. And I think at this point that's what we have to do. We have to deal what we have. We just don't have enough supplies available.
Sure. Dr. A, would you ever consider if the N95 masks were in really, really short supply, and I would guess these dictums would come down from the county and above, would it ever make sense for first responders to reserve the N95 masks for sick people? And, if you're doing a traffic stop, do you really need the N95? Would you be better off using a lesser mask, even a homemade mask, just to conserve the N95s for when you think you're really exposed?
And I think the only situation that is that if the N95 is not used, is that is it a situation that you can actually keep 6 feet between you and the other person. if it is a situation where, you know, the person actually has to come in close contact, I think, you know, we just have to use it at this point because we don't know where we are when it comes to the pandemic. You know, are we gonna have the peak this week or are we having the peak next week? So we don't know when that is gonna happen, and until we peak, we really don't know where we're going. You know, we don't know when it's gonna be. You know, at this point, the amount of patients we have in our local hospital, it is still very manageable. But you know, the day when it's gonna be too much, and you know, everybody is gonna be really suspected, it's unknown at this point when it comes to how many cases we're seeing in the city of Reading.
Right.
Yeah.
All right. Any other discussion on the subject of preparedness among the first responders and how I don't know that we have any special power as the board as far as procurement of any PPEs.
I just wanted to add that we have several members right now that are on quarantine from exposures. So somewhere in the neighborhood between 6 and 8. So we're lucky at this point that we've had low level risk, but as that number adds up, obviously for us, the travel history is huge. One of the most recent exposures that took about 5 of our members at one shot was a vehicle that actually crashed into a building. Driver had an altered level of consciousness. He was unable to provide information, but once our paramedics arrived at the hospital, he provided information. He was a truck driver and he was just in Manhattan. The past 2 weeks, he had a fever. He ended up, I believe he's still in the ICU over at Reading. So the traumatic injuries is a bigger issue. And they were going to test him, but that took 5 of our people out right away because of not wearing our personal protective equipment. So that's why we've gone to that step of just wear it all the time. That way our guys get in that habit.
Oh yeah, that's, I mean, if you have the mask, that's the thing to do.
Absolutely.
You got to treat everybody as though they're infected. And the thing I said a moment ago was just under the circumstances where you're really, really, really short of masks.
Sure.
Yeah.
Absolutely.
All righty.
May I ask a question before we move on?
Absolutely.
Jeremy, I know that Commissioner Leinbach in the past said that he was not interested in having a county Department of Health. Do you think that his position is going to change as this situation goes forward?
Yeah.
Any feelings for that?
My hope is I see a true benefit to that. Not only I think this will open some people's eyes because when you talk to different people, they say, well, we're so surprised we never thought this would happen here. I think that's all just a dollars and cents game. You know, we go through it with the county when we pay exorbitant fees just for emergency dispatching services.
Right.
Everything is supposed to be funded in whole by the user. So I think they are very apprehensive about doing anything that's going to just cost money. And maybe the benefit that comes back isn't necessarily financial, but is a wellness benefit. So I think that's what it is. My hope is that some things need to change after what we're going through right now, not knowing where we're going.
Right.
Now, of course, the question is, had we started a county health department 2 years ago, would we, in fact, be getting this information now? I mean, I don't know that we know for a fact. Maybe it's an arcane law that put these 10, 10 entities as being able to get information.
Sure.
Is that locked, or is it just, is it dictated by whether you have a county health department or not? We don't know that.
That's, when in reading that article, Dr. Dethoff, it appears that they'll only release to basically a county health department, and then that would have the trickle-down effect to possibly a local level board or a local level entity. I know that in speaking with the young lady that runs Allentown's Board of Health, she had access to that information. I've reached out to her because of our situation. She said, well, you're probably going to have an issue because they have a Department of Health, I guess, at Lehigh County, which had helped her. So, or there's some sort of relationship there.
Allentown, where she had it.
Yeah, she's in Allentown. I thought, does Lehigh have a health department?
Well, I'm just pulling up that article right now.
It listed them in there.
Entities to which they share this.
Yeah.
there's a bunch of counties that get it, and then only Allentown.
Okay.
The state has 10: Allegheny, Bucks, Chester, Erie, Montgomery, and Philadelphia counties. Allentown, Bethlehem, Wilkes-Barre, and York also get the information. Now, why that is, I don't know.
Yeah, they have, I know Allentown City actually has a Department of Health for the city. Maybe that's the difference.
Yeah, and somebody suggested to me early on, I don't know if this is true, that the reason they only want to disseminate it to a department that has full-time employees. So I guess the hope would be they would be helpful in, chasing down contacts and things like that. They don't want to. So I don't know.
Sure.
Hopefully I will eventually get clarification from the Pennsylvania Department of Health.
She did tell me, I mean, she's very active with that, because when we had this meeting several weeks ago, and she had gotten court orders for quarantines within the city of Allentown that she was taking care of. And I mean, they were pretty aggressive, and it seemed like, I mean, at that level, that seemed like a good thing to have in this particular instance.
Do they have full-time employed people in Allentown?
Yeah, she is full-time, and I believe she has 1 or 2 other people that help her full-time.
Well, it's interesting when I spoke to that woman from Jefferson County about, hey, why can't I talk to our local woman? She said, well, first of all, she said at one time you didn't even have a nurse in that office. She said, I was covering both my home county, Jefferson County, and Berks County. She said, I think you have a nurse. So it sounds as though they weren't particularly well staffed here at
Sure.
I don't know. I'm just telling you what she said.
Absolutely.
All right.
Very good.
All right. Well, maybe that takes us in. I don't know that the discussion is one and the same, because having a city, we don't currently have a city health officer. I've been around for 10 years here, and I think it was just as I was coming on board that our last full-time true city health officer was around. That was Dr. Hassel. And then there was another guy who was around on and off. So Michelle, and I don't think that a city health officer is synonymous with saying that we become a Department of Health in the city. But we did want to discuss the question of whether we should strive to try to get a city health officer, full-time guy again. Well, he only worked part-time. Michelle, can you give the board a historical perspective of this position? Because I don't think it's been filled in recent years the way it had been filled for decades prior.
So after Dr. Hassel was not with us anymore, we did an RFP and had Dr. Cole.
Hassel did when he was here, because he
Yes.
was the last guy that kind of did the whole deal, I think.
Yeah, he was part-time as well, but he did a lot more in the office. He gave flu vaccines. He did some other health vaccines for our wastewater treatment people. He did, if you requested it, he would do private visits with you and kind of, treat you on the spot, rather than if you were sick at work, rather than have you go out of the building and go to your physician.
He did the work stuff too.
I'm sorry?
He did the work comp stuff at the time.
He did, and he also oversaw, as did Dr. Cole, the handicap parking signs and parking spaces. Dr. Cole continued to do, I believe, just the first maybe year or two, he did the flu vaccines. So I'm not sure how much more of that he continued. But he did continue doing the handicap parking. So we have not had a.
What caused his exit, or what happened there?
Reading Hospital had a change in leadership, and they were going to assign us a different doctor just outright without the city having a say in it.
Yeah, I think what there at one point is he left his private practice and went in with Reading Hospital.
Yeah, I'm not sure how all that worked.
Okay.
But since he's gone, we have, like I said, we did an RFP. I don't think we got any responses, and we haven't had one since then. So we now employees get vouchers for flu shots, and we go out either to our physicians or CVS, who's our prescription provider, and get those. I'm not sure if there's any kind of coverage for our wastewater treatment guys. They are often exposed to things down there that require, medical follow-up. And from what I understand now, the way the handicap parking permit is handled, they go to Public Works and they're almost automatically approved. So as long as you have whether,
Reasonable.
yeah, as long as you have from the state, the license or the placard, you are automatically getting a parking place. But I know that there was discussion, and maybe Sheila can jump in on this,
Sure.
about the city examining whether or not we want to do it. And I just did discover that the state has changed the Board of Health and the health officer's responsibilities, and I'm working on some amendments right now. So Fred, I don't know if you have an update
Yeah.
about where that's going.
Sure. So the first week that we were on the work from home, we were supposed to meet with a Dr. Charles Barbera from Reading Hospital. He had been at the first press conference with the mayor when this whole thing developed on behalf of the hospital. But then that got put on hold. That was just to talk to him if he wanted to be our health officer. I checked with my office because that's where the health officer, when he was in, was based. He had a little office that looks like an exam room there. It's still there. And I was asking, well, what did the health officer do in the last few years? It's been about a year and a half since Dr. Cole was there. And the only thing that he had done when it was Dr. Cole was review those parking permit applications. And so I said, okay, well, how many did he approve or deny? And all the ones that he initially denied were basically just for that person's doctor to answer a few more questions, and then he issued them anyway. So anybody who had the hang tag from the state got it anyhow. And that's what they've been doing since. If they have a hang tag from the state, they get the parking space.
Well, it would be a good question whether most cities of our size have a full-time health officer. I can see in some ways it might be better just to give people vouchers. And, in the old, in previous times, all doctors were private practitioners, and lots of them were probably happy, especially if their practices were in the city, to carve out and come into City Hall for 2 mornings a week. Now the problem is everybody works for the man. And so to get anybody to do this now, you'd almost have to get approval of whoever they work for. Unfortunately, we don't really have, a hospital in the city per se anymore. If we did, maybe it'd be easy to tap them. So I guess the city has to first of all decide whether they really want to do this. And then the second part is to try to find somebody to do it. And I don't know if the second part would be real easy. Does anybody know whether most cities our side have full-time health officers? I have no idea.
I don't, but the state that and I'll share this with you, and Dr. Edoff, I believed I did share with you the new state regulations.
You did.
And so that talks about not only the responsibilities of the Board of Health, if you have one, but also of the city health officer.
Right.
So I am working up an amendment, and I'll get that to our law office. I'll share that with
Okay.
Fred. And we'll see if or what or how far we want to amend our regulations with all of that. So the staff will get into that discussion a little bit deeper as we move forward. But I wanted to kind of take the temperature of the health board members and see how you felt about having a health officer.
No, I think it would be good. I know one of the previous people who, Dr. Eve Kimball, she was chairman of the Board of Health a while back. And, she was kind of appalled when I talked to her and told her, health officer, I've never seen him at any of our Board of Health meetings. And she said, oh, yeah, back in the day, that was one of his prime, jobs, to not only be the health officer, but also help us with the Board of Health, because he was somebody who was there, kind of not on a daily basis, but on a regular basis, whereas we meet once every 2 months. So she thought that having him back in the day was very useful.
Okay. Kathy,
All
Bob,
right, I don't
do you
think
have
we can get
anything?
any further on the discussion about whether to have a city health officer. I think a lot of it depends what the city wants, and we'll look at these codes, and I don't know what, I can't believe Dr. Barbera.
If I can chime in, and I've been, I think I was on mute for a while. With regard to the changes in state law, I'm not sure that they are something we are required to follow. So Shelley, I would suggest, I do think we need to amend our ordinance. It's not even in line with some of the changes we've made with regard to handicap parking. But we should amend it based on what we want to do, because I think under our home rule charter, we're not tied to what the third class city code requires, and can, consult with the board and get recommendations as to what a city like Reading should have as a health officer, but we're not tied down by anything.
Right.
I wouldn't be surprised if 100 years ago there was a full-time, person in the city of Reading, but I don't know.
Probably.
All right, I don't know if there's a whole lot more that we can discuss on that subject. I want to bring up just kind of a moribund subject, and that is, if things would get really bad, one of the things that really shocked me more than just about anything else I've read about this virus is some poor, it was a dialogue on the internet from some guy who was stuck in his house in Italy. The services had broken down so badly people couldn't get to the hospital, and he and his older sister were in the house. Long and short of it is, his older sister had died 4 days previously, and they didn't even have ways to get out and collect bodies and things. Is our coroner's office looking at the potential for worst case scenarios? Do we know?
I can provide some background. Their conversation is they have limited personal protective equipment. So a lot of these situations where the decedent is, whether they're found days after, they're probably not going to be testing these. So those numbers are going to be skewed with actual relevant data as far as who gets tested and who doesn't. I know their personal protective equipment is minimal. And kind of their feeling is, well, if we need help, we're going to request help through fire department or whatever. And obviously the bigger concern is, obviously the virus would continue to live for, I don't know what the period of time would be, but there's still an infection potential there.
Oh, sure. Yeah.
People,
every dead you go to pick up could be contaminated. You don't know.
Absolutely. So, our biggest concern here is obviously that we have a lot of rooming houses. So that's a huge thing, where people are just kind of, whether they pay by the day or pay by the week. We've been checking in with our assisted living and our skilled care facilities on a weekly basis to make sure we don't get blindsided by anything. For instance, like what happened in Washington, where they had an entire nursing home that was sick, and all of a sudden it just became a huge emergency. So,
yeah,
I know the coroner's office is taking, it's kind of we're going to look at this, but there's only so much they can do.
Right.
And it's a scary situation, but I think the numbers, again, they're probably not going to be as accurate as they could be.
Yeah. Well, I meant more from the standpoint of if there are literally dead people and they don't have the manpower or ability to safely extract them from wherever they are.
So they do have large scale planning. I know they have, as part of their larger action plan, they have companies that have reefer trucks that can drop reefer trucks out at their facility where they can.
It's absolutely horrible we even have to have this discussion, but
there's also federal assets that are available in these kind of situations. It's called a federal DMORT team, which deal with significant death. When you're talking many people.
Yes.
There's a lot of different assets at not only at the state level, but at the federal level as well.
And I saw on the news this morning that it was not a true rumor that they're burying people in the parks of New York temporarily. It actually was in the news that they were temporarily going to inter people in some of the city parks. And they came out this morning and said, no, that's an urban legend. But we have no intention of doing that. It's crazy stuff.
Absolutely.
All right. Does anybody else have anything that they'd like to bring up, or I wish we could do more, or anything they'd like to just air or talk about?
No, I'm good.
Our next meeting isn't normally until 2 months from now. Michelle pointed out that on the day when we would normally meet next is the day that, at least for the moment, we've scheduled Pennsylvania elections. So she's going to look at another date. I think that if we as a collective group can do anything to help anybody, and we want to get together, especially since we know it's pretty easy to do here this way, to talk things over, we can certainly call, for want of a better term, an emergency meeting. So I'm certainly open to that. If anybody here feels, anybody can contact me or Dr. A directly if you want to have any concerns.
Yeah, I think we should leave it an open option in case anybody has any questions or anything we can
Yeah.
help with.
That sounds good.
Here we
Yeah,
go.
Dr. A, I'm glad we are here. She is board certified, fellowship trained in infectious disease, so she knows way, 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 way more than I ever learned in infectious disease, and way, way, way more than the average Berks County doctor would know. So we're very, very fortunate to have her expertise on this board. Thank you.
And she has been having so many Zoom meetings. It's not even funny.
Many of us have, yes.
Yeah.
Kathy Shorn, can I ask you a personal question?
Yes.
At our last meeting 2 months ago, you were telling me you were about to take a cruise a month later. Did you take that cruise?
Yes. Yes.
Okay, so you got back. Good. Okay, I was
Got
curious.
back
My wife
safely.
and I were both like, did she take it? Did she take it? Okay.
Well, that's good. Have you been back more than 2 weeks?
Oh, yes. Yes.
Okay, that's good then. We're safe.
Not out on the coast of Florida waiting to get off.
Oh, man.
All
Was
right,
with-
well, if nobody else has anything for the good of the order, can we have a motion for adjournment?
I'll make a motion that we adjourn.
Okay, and second,
Okay.
all in
Second.
favor?
Okay.
All right, everybody
All right.
stay safe. Thank you so much for joining the meeting.
All right. Wash your hands. Wear your masks.
Yes, thank you.
All
Nice
right.
to meet
All
you.
right, bye-bye, everybody.
Bye.
Thank
Bye.
you.
Okay, I have to leave the meeting, I guess. What do we do now?
Stop video.